Is a Senate committee to order, and Chairman Sessler, do you mind gracing us?
We're going to open a short prayer. Pray with me, please. Dear Heavenly Father, we love you so much. You're the giver of all good things. We thank you that you bring us together, Lord God. I pray that we could deliberate wisely and listen to you and follow your leading in all that we do. Lord, you are the great physician. We pray, Lord God, any divisions here would be healed by you, and we would come together and support things that are good and glorify you in all that we do. We pray this in your holy name. Amen.
Thank you. So we have, I'll just talk about the committee. We have a couple of new folks. Senator Chairman Calzert is new ex officio, and Senator Harrell is just coming in. She is new. And
Here you go.
There by Senator Calzert.
Senator Mangum is not here. Okay. All right. And Senator Merritt is here and new. And Senator Walker is not here, Chairman Walker. So, but those are the new ones. Everybody else is the same. Our quorum has not changed, so we have enough for the meeting, and we're going to do three things. Adopt the rules. We're going to do Medicaid 101, and if we have time, we're going to do Senator Chairman Kirkpatrick relating to the controlled substances bill, and she's been very gracious that if we run tight on time, we're going to march it over till Monday. So thank you. So the adoption of the rules there in the left-hand part of your folder, and they are not changed. So I'd be happy to entertain a motion here. Move. Second. And all those in favor say aye. All those opposed, like sign, passes. Thank you so much. Appreciate that. So Medicaid 101 was asked by the Lieutenant Governor's office in conjunction with Senate Health and Human Services to sort of give a little primer relating to this. The governor had a distinct press conference relating to Medicaid and pathways and access. So what do those terms mean? We've been over this for 7 years now. Those are the first two bills that came to this committee. The governor chose to have his floor leader come to the Senate first. That was Senator Blake Tillery, as a matter of fact. And Senator Tillery carried that bill, those two bills. So those were the waivers, Georgia's Medicaid expansion. Those were the waivers to the ACA. And Section 1115 and 1332, those numbers sort of burned in my mind, but they're now known as Georgia Access, which gives private insurance, and that's that 100% up to 138%. And this year it's 806,000 people that are insured with private insurance, so paying 125 to 130% of actual cost, real cost, to the hospitals and providers. And then the pathways, which is the pathways out of poverty. I think that Arkansas's pathways progress or something like that. They just announced that they want to do work requirements, which is somewhat of a misnomer, but Pathways was delayed by, initially approved by the Trump administration, and then was unapproved by the Biden administration, and so Georgia took them to court down in Brunswick, and they lost terribly. Georgia won just about everything. They decided not to appeal because they were concerned that the quote-unquote work requirements would be spread through the United States, and that is exactly what may be happening. You saw that I mentioned Arkansas, but also South Carolina also announced work requirements. And I'm going to come back, circle back on that term. But I think there are around 5,000 or so in that program because of the delays relating to being denied by the Biden administration, and then the public health emergency redetermination, which was required by the feds. So during the public health emergency, before everybody goes to sleep here, we were not allowed, Medicaid patients were not allowed to sign up every year. There's a pregnant pause on purpose because that's what's been done forever related to Medicaid. So you just re-up every year, say, you know, your income is now above the threshold, so you would go to Access, or you were being insured by your employer, or you had a job and so forth, you're making more money. So, but that was suspended during the public health emergency. So redetermination took a year to get done, and then another 6 months to appeal, and the details, I may have those numbers somewhat wrong, but I'll be corrected by Grant Thomas, I'm sure. Those are the two waivers to the ACA. That is the Georgia way of Medicaid expansion, which basically is private insurance in that 100% to 138%. That's 806,000 of 1.5 million people. And then the pathways is what's below that, 100% or below, and we'll get some details relating to that from our speakers. I was trying to think if there's anything else. That's the background. The governor this time has proposed to put foster kids and their guardians, which are basically foster children or wards of the state, and he has proposed to put them in our program, Georgia Pathways, and their parents automatically. You know, the fact is you don't want foster kids, foster parents struggling to get health care. They have enough forms to fill out. They're struggling because they're in that system to begin with. That's why they're wards of the state. So I think that's a very good thing to do. And also, circling back to the work requirements, I knew I was forgetting something. So work requirements, working part-time 20 hours a week, or going to doing community service 20 hours a week, or going to vocational technical school, or going to college, or a combination thereof. And I think there was one more that has been proposed to add, and I'm sure I'll get educated on that too. I think there's one more to be added.
Caregivers of kids under 6.
Oh, yes, caregivers, child care, and I'm not sure of the details on that. I'd love to hear about that. Without further ado, we have 3 speakers today. We got Commissioner John King, Insurance, right? 100 to 100, actually 400% on the exchange, which I carried the bill from changing it from a federal exchange to a state-based exchange. Very smooth transition. Nobody expected it to do as well. If you remember the ACA, when they started, they took months to get the thing going, and the state did a really good job of that transition. Thank you very much. And Grant Thomas from DCH, and I'm sure he's got a gang of people to back him up too. And then we also have with us the Georgia Health Initiative, Insights on Medicaid in Georgia. So what my thoughts is that we would give everybody about 10 minutes to speak, 5 minutes of questions, and we would, we'll see how it goes with that. Commissioner King, thank you for being here. As Commissioner, you always get to go first. You're first in our heart. Why don't you get up there or wherever you feel comfortable, and then we'll go from there.
Well, thank you, Mr. Chairman. Our folks are going to be handing copies of the slides so you can keep and have, so you can take notes. And if you have any follow-up questions, please, please don't hesitate to reach out to us, and we'll give you the additional information for this. I don't know how to describe it better, but this outstanding success that Georgia's done. Good afternoon. Thank you, Chairman Watson, and members of this committee, for inviting us to speak today about Georgia Access and incredible work of this Georgia-based team to increase the quality of affordable care health plans in Georgia. As you see on page number 2, a little bit of background. Georgia's health marketplace was plagued with limited coverage options, lack of access across the state, and high premiums. But it began to change when the General Assembly passed Governor Kemp's and signed the Patients First Act in 2019. This allowed us to pursue new ways to increase access to health coverage, especially in our most underserved areas of our state. Following the implementation of Senate Bill 65, which was sponsored by you, Mr. Chairman, we launched Georgia Access as Georgia's new state-based exchange, which fully replaced healthcare.gov on November 1 of 2024. As a state-backed exchange, Georgia Access administers all required functions of the exchange, including consumer eligibility, enrollment system, consumer contact center, and small business health options program, SHOP, plan management, agent certification, and more. If you go to the next page, our first goal in Georgia Access was to increase, simply our primary goal was to get more people covered with health care coverage. And it's the same mission that the federal government had, and we talked a lot to CMS, that we had but we knew that we knew the state of Georgia better, that we could market the programs better, because we were going to the communities and going to the places where people are gathering, not expecting people come to us. We went from Gainesville to Dalton with Spanish speakers, to Savannah, to Dublin, all over this. We went to the high school football game in Lowndes County, because that's where people are gathering. That's where a great place. One of the incredible performers in this has been in Albany. The Boys and Girls Club is where people are naturally gathering communities, and we had folks there to answer those complicated questions that people are mystified when it comes to choosing healthcare. And so our state is incredibly diverse, and so we had a tailored message for every one of the communities. And our second goal was to improve the consumer shopping and enrollment experience. We wanted to make it efficient and fast, but answer the questions of the consumer and not direct. Our primary talking point was there was no wrong door to get coverage, that you could go through multiple lanes to get access to quality health care coverage. We know that insurance, especially health insurance, is complicated, and we wanted to make it as simple as possible for consumers to enroll and to get the best coverage designed for them specifically, not what the government wanted to give them, is something tailored to their needs. And the third part is to strengthen competition, innovation, and private sector investment in Georgia's health insurance market. By increasing the number of insurance carriers in Georgia's market and establishing a unique partnership with private sector companies, consumers will given greater access and choice for health coverage, especially in rural and underserved areas of our state. If you go to slide number 4, open enrollment in 2025, which lasted from November 1, 2024 to January 15th of 2025, was a resounding success in Georgia by several metrics. We outperformed nearly every state-based exchange across the nation, and even we outperformed healthcare.gov. Over 1.5 million consumers enrolled in health care coverage through Georgia Access. That makes us the second largest state-based exchange in the country, just behind California. 57% of the enrollees fall under the 138% federal poverty line coverage. For these individuals, the coverage is fully paid through federal subsidies. And over 225,000 consumers who enrolled this year have never been enrolled in healthcare, have never been enrolled even through healthcare.gov. They're brand new consumers into the marketplace. Over 100,000 of those new enrollees were part of this group. This is the single largest enrollment growth at any state-based exchange in the country. In addition, more than 95% of the consumers were eligible for financial assistance. That is 1.46 million Georgians. Next slide, please. We often get asked, most people hear about and sign up for coverage because it's going through the state website or just several ways to sign up. Insurance agents were the key healthcare insurance agents were the key to the success here. They're an incredible resource to consumers because they're there to answer those questions that only one person to another human being, not through a phone, but many times through in person. And that's the whole purpose of this marketplace, is to connect insurance companies with products, with knowledgeable agents, and that consumer. This year, we had more than 17,000 licensed and certified agents assisting consumers all across Georgia. Nearly 80% of the consumers utilize the assistance of an agent. And apparently approximately 70% of the consumers or their agents signed up through web broker or insurance carrier, like Help Sherpa, for example, one of many organizations that help people target them and get them into the right plan, who offer an alternative method to enroll. Again, no wrong door to get coverage. And if you go to slide 6, to give you a representation of how far we've come in just a few years, please take a look at this comparison between 2018 and 2025. As you can see, enrollment has more than tripled since 2018. The number of health insurance carriers participating in the market have more than doubled, increasing the consumer choice and driving down prices through competition. In addition, there's no counties left with a single carrier choice for coverage, which is incredible. When we first came in the door, you know that we had many counties that only had one carrier participating in the market. Mr. Chairman, this is a direct result of the efforts of not only the incredible group of talented folks that work on behalf of Georgians for our agency. We got our team here is ready to answer any questions, but I appreciate the opportunity that this committee gave an opportunity for Georgia to take responsibility for the healthcare marketplace for Georgians, instead of just continue sending it to Washington and expect Washington to understand how diverse Georgia is. And we're tasked. I'm an elected insurance commissioner, and I'm accountable to the people to make sure that these programs and the things that fall under our agency, that we produce valuable results, will come and inform the legislature to discontinue those efforts. So thank you so much for the opportunity to serve, to take responsibility for this program, and of course to publicly thank the incredible team working in our Georgia Access. As you can see, we're excited about the data that's been generated. We're studying the data. How do we position our agency for the future enrollment and periods of enrollment? And so I'll stand by and take any questions or thoughts.
Man after my own heart here. He did that in about 8 minutes. Wow. So
You
2
give me
minutes to
a
spare.
deadline, sir.
Let that go out to the rest of the committee and the members in the audience. Brevity is much appreciated, and you covered a lot too. So let's open it up for questions to the committees. We plan to do 5 minutes there. If we're running ahead, we'll get Dr. Kirkpatrick's bill done. Questions from the committee relating to Georgia Access? Yes, sir. Number 5.
Mr. Chairman, the chair talked earlier about the work requirement as part of this. Other than a work requirement being in this mix in the conversation, is there anything different about our qualifications or the program?
Same requirements as for the ACA. Our program have the same base requirements. Our policies that are offered on Georgia Access meet or exceed the federal healthcare.gov. Yeah, and work requirements are for pathways. We don't have work requirements for private. This is private health insurance access.
Gotcha.
So that's a good point. So everybody in the rooms, because that's why we're doing Medicaid 101. Access has no, again, work requirements in quotation marks, because remember there are about 4 or 5 other things that you can do, and Pathways does. And remember, that's Pathways out of poverty, and you have health insurance while you're traveling that road. Any other questions? You answered all the questions. No, Senator Orrock. number 9.
Thank you, Mr. Chair. Thank you, Commissioner, for coming before us. The amount of money that's been spent thus far, that's been spent on pathways, right? Upwards of $30 to $50 million.
You have to ask Mr. Grant that question, ma'am.
So-
I tried not to get into
So
his
access-
lane.
let me-
Because what you're
let me
doing
ask
is, what you're covering is the private insurance
Private
market.
insurance, yes. ma'am.
Right, so that's cost the state, remember, that was part of the bill when we switched it over from a federal to a state-based exchange, the 1% fee or whatever it was goes to
We
run
operate
it.
this program through the fees generated from the marketplace. So there's not a burden on the taxpayer. And so the fees, and also any excess beyond that, running the marketplace goes into the high-risk pool, which is what has caused insurance companies to come and participate in the marketplace in rural parts of Georgia.
So the 100% up to 138% pay no premium, correct, or no?
It's all adjusted based on the money, but most people are buying, the majority of them are fully subsidized, sir.
Or fully subsidized, gotcha. Okay.
And
But it's private health
just
insurance.
to follow up, on the premium side of things, have the premiums charged by the these private insurance companies, have they gone up or down? People are quite concerned about the money they're paying out for premiums in general to the insurance.
Premiums have actually been lowered 17 to 20% in parts of rural Georgia. Not so much here in Metro Atlanta because there's a lot of competition, but in rural parts of our state, we've seen dramatic drops because we have more companies competing. And so that's what the market forces are causing companies to get more, understand their data, understand the market better, and offer products that people want to buy.
So 17% reduction, and I'm looking at slide 4, 95% of the access consumers
Yes,
were
sir.
determined eligible for financial assistance. So 1.46 million out of the 1.5 million.
Yes,
I
sir.
got you. Okay. And it's less. So 17% reduction. That's competition does.
And I will add, sir, that many other states, especially in the southeast region, are looking at Georgia as the trailblazer in this area because it puts control back into the states.
It makes sense. Thank you. So again, we are, unless there's a question, Senator Halpern, number 11.
Thank you, Mr. Chairman. Thank you, Commissioner King. I have a question as it relates to pertaining to the enhanced premium tax credits. Under the Inflation Reduction Act, which have significantly increased enrollment in Georgia's health insurance marketplace. In total, around 830,000 Georgians, over 60%, enrolled in Georgia Access have incomes between 100 to 150% of the federal poverty level, meaning they currently have a $0 monthly premium.
That is correct.
If these enhanced tax credits expire at the end of 2025, estimates suggest that average annual premiums for subsidized enrollees in Georgia could increase by approximately $500, with lower income enrollees facing the most severe affordability challenges. And meanwhile, middle income Georgians who already pay higher premiums would see even larger increases, making coverage less affordable across the board. So given Georgia's transition to a fully state-based marketplace this fall, how is the Department of Insurance preparing for the potential expiration of these subsidies?
We're making plans in case, but in all fairness, Washington needs to do their job. When they do their job and make the determination, then we will adjust. But we still, the performance of this team, led by this wonderful woman right here, we will compete against anybody, against any state, and we've outperformed the federal government. So if the subsidies end, it will affect the whole nation.
Yeah.
And we will adjust, but we've done it more cost efficiently, and we will always never forget that we take care of Georgians because we are Georgians. And so we'll outperform the federal government every day of the week. And so when we'll cross that river when we get to it. I don't want to, this is something that obviously is in you all's role to influence our congressional delegations and our leaders in Washington to do their job. But we are preparing for that. But I'm going to let them do their job because they have a big job to make. They have to make a decision.
All right, I think we've expired the time. Thank you. We're at almost 7 minutes now with questions, but, there are unknowns.
Yeah.
And there are going to be unknowns. That is unsettling for people, produces anxiety.
It is.
I've seen the anxiety over the threat of, the FMAP being adjusted relating to Medicaid
Yes.
expansion, and so, or explosion, as I call it. So,
We're
listen, if that
we're tracking these
changes,
issues
then,
every day, man. We're not getting our eyes
yeah,
off
so
the ball.
there are certainly a lot of unknowns. Thank you, Commissioner.
Thank you so
Great
much.
job.
I appreciate the opportunity to come and report to you and look forward. Please know that my team and I are absolutely available for any follow-up questions or any data that you need to make the important decisions that you got before you.
I know you are. Thank you.
Thank you.
All righty, so next up is Grant Thomas with DCH to discuss Georgia Pathways. He's got former senator, always a senator, Dr. Dean Burke by his side. Welcome back. Good to see you both. The floor is yours.
Good to see you as well. Thank you, Mr. Chairman and members of the committee. I did decide to bring pretty strong reinforcements today with a former physician and member of the Senate body, so thank you, Dr. Burke. We've got a PowerPoint slide up here. If you could go ahead and go to slide 5, please, of the presentation. So both Commissioner King and Senator Watson gave a great overview of Patients First Act and how we got to where we are today and the framework that we now have in Georgia. And of course, Commissioner King gave a great overview of Georgia Access. I'm here today to provide updates on the Georgia Pathways program. And I also think, as a part of that, it is important to, provide the whole picture of the Patients First Act. I think a lot of times, when the Pathways program is discussed more broadly, it's looked at solely as at the Pathways program, but really Pathways fits in with the broader framework of traditional Medicaid, Georgia Pathways, and Georgia Access. And it's really all those programs that work together to provide health insurance coverage to low-income Georgians, and as Commissioner King talked about, all Georgians of various levels of income if they do not have employer-sponsored insurance. So in 2019, as Senator Watson said, Governor Kemp and the General Assembly passed the Patients First Act. This was passed overwhelmingly, and it authorized the state to seek 2 waivers from the federal government to increase health coverage in Georgia. These 2 waivers include a state waiver for the Medicaid program, Georgia Pathways, as well as Georgia Access. These 2 programs, like I said, work in concert to provide coverage options to give Georgians more options for obtaining quality health care and ultimately access to health services. And like I said, Pathways is one component of that framework along with traditional Medicaid and Georgia Access. They must be looked at all together as none of the programs operate just independently on their own. And the vision for establishing these programs was for them all to work together. Next slide, please. So here are the state healthcare coverage options. Of course, there's a state health benefit plan, which isn't listed here, but I think I would include that in private health insurance coverage through employer-sponsored plans. So these are the programs that the state offers to individuals who are not receiving health coverage through their employers. So you have traditional Medicaid on the left. You see some examples of individuals who would fall under those programs. The Georgia Pathways program launched in July of 2023. This program's targeting individuals who are 19 to 64 with a household income of 100% of the federal poverty level or less. In layman's terms, that means $15,650 a year for an individual and $26,650 a year for a family of 3. It is expected that as a Pathways member's financial circumstances and income improve with free health coverage, the individual will be able to transition to employer-sponsored or Georgia Access. Pathways, is intended to support members in their path towards financial independence and private coverage. I think it's one point that I really want to underscore, and I know Commissioner King talked about this. Of the 1.5 million individuals who signed up for Georgia Access health insurance in 2025, 810,000 are covered that are in between 100 and 138% of the federal poverty level. So due to Georgia's unemployment rate being very low, record lows of 3.7%, more individuals are working, earning higher incomes, and a vast number, like I said, 810,000 are just over the poverty level, so they're actually over income for Georgia Pathways. And believe it or not, being over income is the number one reason most people are denied when they apply for Pathways. Actually, over half of denials are denied because they are over income, and we don't think that's a bad thing. That's actually a good thing, because then they can go get private insurance at a $0 premium plan on Georgia Access on the marketplace. Through those health plans. Together, working together, Pathways and Georgia Access, we are covering 816,000 people under 138% of the federal poverty level. So like I said, Pathways was intended to be an insurance pathway to give individuals those options for commercial insurance. Any individuals over 100% FPL, as you see on the right, get their coverage through Georgia Access and have $0 premium plans. I want to underscore, too, a difference between Georgia Access and Medicaid and Georgia Pathways. Individuals on Georgia Access can enroll through multiple front doors. So they can enroll through web brokers, agents, carriers. Individuals who enroll on Medicaid and Georgia Pathways enroll through a government website, one option. So the private sector is driving a lot of the enrollment. They are doing a lot of outreach. They are providing assistance to people to apply and enroll. That is all unique to the marketplace and something that it does not operate that way in Medicaid. I really want to emphasize Georgia has taken a commercial insurance first approach. Private insurance provides more robust provider networks for patients and higher reimbursement rates for providers. What Commissioner King mentioned, 130% or more over costs, whereas Medicaid reimburses a percentage of costs. Georgia has chosen to cover those individuals within the federal framework whenever and wherever possible on private insurance on marketplace, and leave Medicaid for the individuals who the program was originally intended for. So that includes pregnant women, children, the elderly who need around-the-clock care, who are in nursing homes, individuals with intellectual and developmental disabilities. That is what Medicaid is intended, and we have also provided a coverage option through Georgia Pathways, and you see the income limits there and the requirement for different qualifying activities. It's not up on the screen, but it should be on your one-pager. Listed are the qualifying activities that someone could participate in. So this is full-time employment, part-time employment, on-the-job training, job readiness assistance programs, community service, vocational education training, enrollment in GVRA. One category that has seen a lot of interest is students. So students enrolled in higher education, our technical colleges, our university system, USG institutions, private colleges, because a lot of college students are 19, 20, 21 or older, and they're also doing one of the activities. They're enrolled in higher education, and we've also done electronic interfaces with USG and TCSG to allow those individuals to report that information through that electronic transfer instead of having to submit that manually. So we've done a lot of outreach, and they have been great partners with us in the higher education system. Next slide, please. So this really just wanted to level set and provide information on the uninsured and how census data works, which is usually, the, I guess, consistent framework for, how people look at who's being covered and not covered. This is 2017 uninsured data. Census data runs on a 2-year lag. So when we were developing Pathways and Georgia Access in 2019, we were looking at 2017 data because it runs on a 2-year delay. As you can see there, Georgia's uninsured rate was 14.9%. And it breaks it down by different income categories. So the population that's under 100% FPL, which again is like 15,650 for an individual, they are in that 19 to 64 group, that 408,000. So those would be individuals at that time who were eligible for either Pathways or traditional Medicaid. I want to emphasize that that number is not just Pathways potentially eligible. It could also include traditional Medicaid individuals because it's looking at the age and income and not other factors. So there could be very likely are individuals who are uninsured who already qualify for traditional Medicaid, and we see that a lot through Pathways too, where individuals applying for Pathways because it's the same Medicaid application are getting approved for traditional Medicaid when they apply for Pathways. It's actually a lot greater than the number of people being approved for Pathways, which is a good thing with all the marketing and outreach we're doing, getting people eligible for programs that they qualify for. Then on the right-hand side, you can see, 100 to 137, and then 138 to 399. Those are the marketplace eligible individuals. So those were uninsured individuals on the marketplace who were eligible for marketplace plans. Next slide, please. So this is 2019 data. This is what the situation actually was in 2019 when we were developing the waivers. You wouldn't have seen that for 2 years later in 2021, however. So uninsured rate goes down a little bit, 13.4%. And, you see that number of potentially Pathways, traditional Medicaid, 19 to 64, under 100% FPL has dropped from 408,000 to 290,000. So that, Georgia's not losing population, so we're growing as a state, so a lot of individuals are earning more, lower unemployment, they're getting opportunities to qualify for insurance on the marketplace. Next slide, please. So this is current situation. This is the latest data that we have on the uninsured that came out recently, 2023 uninsured data. As you see, the uninsured rate has gone down even more. It's now 11.4%, and you can see that the number of uninsured between 19 to 64 under 100% FPL, so that's potentially eligible for traditional Medicaid or Pathways, is at 246,000. So again, that number has dropped even more now from 290 to 246,000. So the number of eligible people since we wrote the waiver have decreased almost in half because it was at 408,000 at the time we wrote it. So a significant number of people are no longer eligible for Pathways because likely their income has gone up, and you can look at the enrollment on Georgia Access that demonstrates that. They're at 1.5 million, 810,000 of which are between 100 and 138 FPL getting $0 premium plans. You can go to one thing I want to emphasize before we move on, you look at the marketplace eligible. So the total uninsured in Georgia based on 2023 census data is 1.2 million. If you look at the marketplace data in the bottom right, if you total those different categories up, the 217, the 601, the 114, that's over 900,000 people. So when people talk about the uninsured rate, who's uninsured in Georgia, that gives you a good idea of who the uninsured actually are. There's 1.2 million, and over 900,000 already qualify for private insurance on the marketplace. They just haven't signed up yet for whatever reason. I think this data is 2 years old since this is the most recent we have, but you can see through the gains that Commissioner King and Georgia Access have done that a lot of those individuals are now being served on the marketplace. So, that number is probably, that 900,000 has probably been, reduced a lot with the work that they've done on Georgia Access. And then, of course, the 246, that would be the maximum eligible for Pathways, but there's also traditional Medicaid who are eligible within that number as well. But that, and then the 289,000, there's some children and elderly who are uninsured, but they should be able to qualify for Medicaid if they're a child, or Medicare/Medicaid if they're over 65. Next slide, please. So I won't go into all this again. Commissioner King did a good job of just providing an overview of this, but if you look, this was last year's data, so it's grown even more with their 2025 numbers, but that 100 to 150 is zero premium eligible on the marketplace. They don't pay a dime in premiums for their commercial insurance coverage. And then you can see the breakdown by income on the right of various income levels and the subsidies that they get on the marketplace. So no one pays more than 8.5% of their income. Even if you're well over 400% FPL, you're going to be capped at paying out of pocket more than 8.5%. And federal subsidies provide that coverage at no cost to the state. Yeah.
You gotta,
Okay. Yeah. We'll just go a little more. I'll hit on these last ones really quickly. So this is the timeline. As Senator Watson said, we had a 2-year loss because of litigation, so we launched the program 2 years late in 2023 instead of 2021. Lost valuable time because, like you said, redeterminations. Next slide, please. The goals of the Pathways program, been over that. Next slide, please. Again, requirements. Next slide. Those are the qualifying activities. Next slide. Next slide. So just want to emphasize we have been prioritizing marketing and outreach. This is paid media on, for Pathways, reaching those 246,000 Georgians through social media ads, search engine optimization. We've also been working with higher education institutions, different community organizations across the state to get the word out about Pathways. Next slide, please. Those are just some metrics of the marketing and outreach campaign over the last several months. We've had 1.4 million users visit Pathways website, as well as 48,000 apply button clicks. So this is the current enrollment for Pathways, 6,514 members currently and actively enrolled in the program. The number I also want to emphasize, those that on the right, 9,160, that's the total number of individuals served since the program started. So we've had churn and numbers individuals falling off. The number one reason, like the people who get denied for Pathways, most of the number one reason that they fall off is because they have become over income, in which case they would go to Georgia Access. And we've worked very closely with Commissioner King's office to make sure that that is a smooth transition, one of the advantages of having a state-based exchange.
thank you. We
Yep.
appreciate it. You anticipated some questions, I'm sure, coming. Senator Nikki Merritt is on 8, 9, 10. Okay.
Thank you, Mr. Chairman. Okay, yeah, thank you for your presentation. I have a question, and this regarding the cost. I'm concerned about Pathways cost and your uninsured population data that you have here. So the Pathways coverage, the application recently released by the department estimates that 30,000 low-income Georgians, and yours is actually 38,358, low-income Georgians will be enrolled in the program by 2030. But there's an estimated 240,000, which yours is actually 246,365 uninsured low-income Georgians who are potentially eligible for the program. So my question is, why are we paying so much to only cover about 12% of the folks who are in the health insurance coverage gap?
Absolutely. So first, to address your cost concern, I think every program has costs when when it's starting. There's systems changes that are required. There's policies. There's approvals at CMS that have to happen. I would also say that due to the delay by the Biden administration, in which we were delayed 2 years, which was overturned by a federal judge, we had to duplicate a lot of costs because we had to ramp up again, and we had to stop, start, and then start again, stop and then start again. So there was that constant back and forth. I would also say there's significant savings to be gained by the fact that we only expanded up to 100% FPL, because all of those individuals between 100 and 138 are now on the marketplace where they pay $0 premiums. And under other proposals, we would have to pay 10% of that cost, so we're saving there. And then I would also say our providers and hospitals across the state are able to access commercial plans for those 800,000 individuals who are on the marketplace instead of Medicaid, because we left those individuals on the marketplace when we only expanded to 100. So they're actually getting higher reimbursement, and that's better, for our providers, and the patients have broader provider networks. I would say on your questions about enrollment, So no state has a 0% uninsured rate. It requires people to apply and then enroll in the program, so they have to take action on their own. That's really something that we have taken a strong focus on to do marketing and outreach to make sure that individuals who potentially qualify for the program know about the program. It's never enough to just create a program and then hope people find out about it. You have to do a lot of outreach in order to get people aware of it and to apply. You've seen that with Georgia Access. They've actually been doing marketing and outreach at the state level for a number of years. We only started with Pathways a few months ago in the fall of 2024, so that takes some time. I would also say that it's hard to predict the enrollment numbers because, like I said, that number when we wrote the waiver was 408,000, and now it's been reduced to 246,000 who apply, and it's 2 years old. So our unemployment rate is still 3.7%, excuse me. So a lot of those individuals are making over that amount. Just to give you some perspective, if someone works a full-time minimum wage job 40 hours a week, they're likely right at or above that $15,650 a year. So they would be incomed out of Georgia Pathways, which isn't a bad thing because they can qualify for insurance on Georgia Access.
Thank you. Any other questions? All right, so, those buttons don't work, but,
Just have to live with that.
Senator Rock, you've never had any trouble getting my attention, so.
I appreciate that, and I hope that continues, Mr. Chairman. I appreciate that very much. Thank you for your presentation. Number one, and I guess I have about 3 inquiries. Why don't did you give us this? Is this printed out? Is this in our folders?
I did email it to Senator Watson's office, so they should have a copy of it.
But we
It's in your folder.
Nandy,
Oh, not the slides, no. But we can
We do
get
have
you-
two
we can get you a copy.
one-pagers in your folder
We can get 'em.
that have some of that data, but we emailed the presentation.
But we don't, is the presentation in everybody's folder? No.
You got
Because
the-
To follow all of this nuance and detail, that's
We can get it to you.
essential. Well,
Yeah.
yeah, it would be great to have it, in order for it to be useful to us. The fact of the matter is that if Georgia had expanded Medicaid, as 40 other states have done, including our sister state, North Carolina, we would have matching federal funds. And you're not getting any match of federal funds for what we're spending on this program, as I understand it. Isn't that the case?
So,
I have one more question.
Yeah, of course. So to speak to more nuance, because we only expanded to 100% of the federal poverty level, we were able to keep 816,000 Georgians on private insurance in which the state does not pay a dollar for. So that's 816,000 people. We're not paying 10% of those costs as a state, had we fully expanded Medicaid. Those people also have private insurance. So the reimbursement rates for our hospitals and our providers are higher. The networks are better for the population that it's meant, or, for the population that has those commercial plans. And then, we've also kept 810,000 people out of our limited Medicaid provider network. So only about 64% of doctors in the state accept Medicaid, and 60% accept new patients. So we've been able to preserve those Medicaid providers and that network for the people who truly need it the most: the children, pregnant women, individuals with intellectual and developmental disabilities. So I think from a cost-saving standpoint, we've actually saved that 10% for those 816,000 individuals, and we've also been able to get our providers higher reimbursement rates, which is
And
critical.
we appreciate that. I mean,
Yeah.
and listen, like we don't know everything in the future. I mean, the FMAP that's on the table too, I understand. The FMAP relating to that 90-10 split going down to what we pay now is about, 2/3 and 1/3. So that's a significant saving right there. All right, so we don't have time for another, you can do that. You can do that.
$2.8 billion in the federal budget designated for Georgia as a signing bonus if we would expand Medicaid 138%. Isn't that right?
Currently, there are incentives. I don't know about your exact number. I know about the, what you're referring to with it.
North Carolina got $2.8 billion.
Right.
As their signing bonus.
Yes, aware of the 90-10 and the signing bonus. I mean, I'll just go back, to my other point about the savings we're getting with the 10% not paying for them when they're in the marketplace, the better reimbursement rates there. Also want to point out the point about the multiple front doors that they have on the commercial marketplace, whereas Medicaid, you have one government website. So I think, allowing individuals to enroll through multiple channels has also helped significantly with that enrollment. And then lastly, I will say to Senator Watson's point, we don't know what the federal government is going to do. So we know we have a new administration. We know we have a new leadership in the Senate, as well as the same leadership in the House. So we don't know what they're going to do to the federal Medicaid program. I don't want to speculate on specifics, but there's been a lot of discussion of certain things they would do that are very different from the incentives that you just outlined. Those could be changing significantly, and not only going away, but causing adverse, certain fiscal impact to states that have already expanded.
All right, thank you. We've sort of gone over time here. I apologize about that. And you can do that offline. We're on time stretch, and we got the last one. Okay, I appreciate it. Thank you. Thank you, Mr. Thomas and Dr. Burke. I do want to leave time for the Georgia Health Initiative, so the floor is yours. Thank you. I apologize. We won't be able to do the bill today, but I'm sorry about that. Senator Kirkpatrick, chair lady. It probably could be. You never know. All right, we got to do pass. There we go. All right. All right, there. Thank you.
All right. Well, good afternoon. My name is Cindy Zeldin. I'm the Vice President of Health Policy and Government Affairs at Georgia Health Initiative, which is a nonprofit, nonpartisan private foundation with a statewide focus on health. Thank you, Chairman Watson and members of the Health and Human Services Committee for inviting me to present for today's Medicaid 101 portion of the meeting. Just before I dive right into the Medicaid content, I wanted to take a moment to note that we have shared some materials with you, including our Insights on Medicaid in Georgia companion resources. There's an overview and context document, looks like this. As well as a data and trend analysis publication that looks like this. And we also have included a one-page overview of Georgia Health Initiative that provides some additional information about our nearly 25-year history in Georgia and the work that we do with communities and sectors across our state to improve health. Earlier this month, Georgia Health Initiative released the first of one that presents complex data and information in an accessible format for Medicaid experts and novices alike. And I do want to acknowledge the Department of Community Health for providing a good amount of data and contextual information that help make the development of this resource possible. Within the overview and context document, you'll find an overview of Medicaid in Georgia, including information about governance structure and authorities, as well as a snapshot of the history of Medicaid in Georgia and an accompanying timeline of changes implemented to Georgia's Medicaid program. While I won't cover that information in detail today, please know that it is there as a resource. The Data and Trends Analysis publication features data and insights on Medicaid eligibility and enrollment, covered benefits and services, operations and infrastructure, including the managed care delivery system, expenditures and financing, and state priorities and national trends. So I will largely focus on those areas in my presentation today, and will reference that Data and Trends publication throughout. As you know, Medicaid is a joint state-federal program that provides health coverage to 2.3 million Georgians, including more than 2 in 5 children in Georgia. Medicaid finances nearly half of all births in Georgia and covers approximately 3 out of 4 nursing home residents. In many ways, Medicaid serves as the backbone of our state's healthcare system, comprising 22% of the state budget and bolstering our state's healthcare infrastructure and overall economy, particularly in rural communities. So this slide here shows that Medicaid enrollment, shows total Medicaid enrollment in Georgia over time, which is helpful to look at. And you can see that enrollment peaked at 2.8 million during the public health emergency, during which time states could not disenroll anyone from the program in exchange for enhanced federal funding. It has since fallen to about 2.3 million following the unwinding process when eligibility was redetermined for all members. If you look at the next slide, the majority of people enrolled in Medicaid in Georgia are children, as you can see in the bar graph here. And in this graph, you can see the age breakdown, 0 to 18, 19 to 64, and 65 and over. It's kind of a different way of slicing some of the data that Grant just presented. The orange represents low-income Medicaid, the purple is age-blind disabled, and the teal is Peach Care for Kids, just so you can see what's on that chart. To be eligible for Medicaid, individuals must fall into one of these categories and meet income eligibility criteria. There are, of course, numerous very specific eligibility categories, but they are generally grouped into these 3: low-income Medicaid, age-blind disabled, and Peach Care for Kids. So to illustrate the specific populations with some of these groupings, examples for low-income Medicaid include children, pregnant women, and some very low-income parents, and Georgians enrolled in Pathways to Coverage. For the age-blind disabled population, children and adults with disabilities who receive SSI, seniors duly eligible for Medicaid and Medicare, and individuals needing nursing home care, as well as many other specific categories. And Peach Care for Kids is Georgia's Children's Health Insurance Program, or CHIP. If we can go to the next slide, we will show Medicaid enrollment by county in Georgia. And while not surprisingly, more populous counties have higher enrollment in terms of raw numbers. Less populated and more rural counties tend to have higher percentages of their populations enrolled in Medicaid. So you can see on this map that the dark purple shading represents a higher percentage of the county population enrolled in Medicaid, and the lighter purple is a lower percentage of the population. We can move to the next slide. Moving now to covered benefits and services. This slide depicts services provided by Medicaid in Georgia. I know there's a lot of text on there, so don't worry about reading all of that, and everything is in the publication. You'll notice in the publication itself that we also provided a little bit of deeper information about early and periodic screening, diagnosis, and treatment, or EPSDT, and that set of services for children, as well as an overview of services provided through waiver programs serving seniors and individuals with disabilities. If we can go to the next slide. Benefits and services are delivered through Medicaid's network of providers. Georgia Medicaid enrolls most licensed healthcare provider types and also enrolls facilities like hospitals, nursing homes, and community mental health centers. Medicaid providers must go through a credentialing process to provide services to members in managed care or CMO networks. About 63% of all PCPs in Georgia are enrolled in Medicaid, and all of the state's acute care hospitals are enrolled in Medicaid. Care management organizations are subject to geographic access standards, which you can see here, and the majority of standards are met on a regular basis, but scoring below 90% does occur regularly for certain provider types where there may be overall provider shortages. Examples include hematology or oncology physicians in rural communities or 24-hour pharmacies. The next slide covers utilization of various Medicaid services and associated spending. The 4 largest benefit categories from an expenditure standpoint are inpatient hospital, pharmacy, behavioral health, and outpatient health, together representing about 68% of Medicaid spending. If you take a look at the Data and Trends publication, you may notice that we have included several pages of information and data that I won't get into now on Georgia's managed care delivery system. We provide a timeline of if you can go to the next slide, of the evolution of Medicaid managed care in Georgia, starting with 2006, when managed care began here in Georgia, and taking us through the estimated go-live date for new managed care contracts in mid-2026, as well as the anticipated carve-in of additional populations to managed care in 2028 to 2030. Next slide. Georgia's managed care program is known as Georgia Families, and currently the care management organizations cover about 75%, or 1.7 million of Georgia's Medicaid members. You can see here the current member enrollment by CMO and the capitated rates for each plan. Overall, populations or payments for populations enrolled in managed care account for about 40% of total Medicaid expenditures. We've also highlighted within your publication select anticipated changes coming with the new Medicaid managed care contracts that were recently rebid and anticipated to take effect in mid-2026, following contract negotiations, implementation planning, and readiness review. Shifting now to Medicaid expenditures and financing, you can see here total spending on Medicaid in Georgia by sources of funding. There's a number of there's a key on the right, and there's a bit of shading here. So just to take you through this, federal funding represents $9.34 billion of the total $14.6 billion. And then this is also broken down by these broad eligibility categories. And notably, costs per enrollee are substantially higher for the ABD population. And you can see that reflected here with some of the larger chunks, in particular the darker purple and darker orange, representing for spending for Georgia's ABD Medicaid population. So we see the federal and state as well as the category of eligibility there. The next slide, we provide information about the federal medical assistance percentage, or FMAP, which is the formula by which federal funding that flows to states for Medicaid is determined. Of note here is that in 2025, the FMAP is 66.04, which means the federal government contributes about 66% of the cost, and the state just under 34% of the cost of Medicaid in Georgia. The federal share for CHIP is higher than Medicaid, is about 76% federal for 2025. And then shifting now to the last section on state priorities. As part of the research for this report, our project team interviewed state officials at the Department of Community Health to understand what some of their focus areas are over the next 2 to 3 years. I know you just heard from the Department of Community Health. I think these are some additional priorities that they shared with us, and we are in turn sharing with you. We're very appreciative for the information they provided to us. In addition to the new managed care contracts, some of the other priorities include procurement of new eligibility determination information system, maintenance of the directed payment programs, implementation and procurement for the PACE program, implementation of qualified residential treatment programs, and expansion of certified community behavioral health clinics, among others. So lastly, please note in the data and trends analysis report, you will find a review of national trends in the areas of benefits, eligibility, and financing, wherein we highlight areas where there's some traction among a critical mass of states. For example, pregnancy and postpartum services, behavioral health, and dental benefits are areas where states have a lot of activity going on. So that concludes my presentation. Of course, there is much more data in the handouts that you have. I want to thank you again for the opportunity to share this information that we pulled together with you today. Please consider Georgia Health Initiative a resource in your work. Don't hesitate to reach out to me or my colleague Sarah Phillips with any additional questions about anything presented here or any of the materials we shared.
Thank you,
with
Ms. Zeldin. We appreciate the information. Y'all were part of the organization that spearheaded this discussion, and Lieutenant Governor's Office appreciates it. We appreciate it, and thank you for the information. Any questions from the committee? Senator O'Rourke.
Thanks very much, Cindy, for this comprehensive data sets. Just a quick question. Do you have the number of hospitals that have closed in Georgia? over what period of time? And then a comparison of that with nationally. I know that's not just a Georgia trend, but
Right. Not in front of me, but I'm happy to get it for you.
that'd be helpful.
Thank you, appreciate that.
Thank you.
Love to have that. Any other questions, Senator Lucas, you got a question?
I wasn't able to ask the question I wanted when they were up there.
We can get them offline. They're going to be back up here in just a second. We can
Yeah, we don't
ask.
have a problem with the budget dealing with this money. And I wanted to ask the question, how much pathway costs versus how many people they have in it.
All right, we'll get that answer for you. What else we got? Anything else? Anything from Ms. Eldon? Thank you so much.
thank
We're
you.
gone over our time, and I'm sort of a firm believer in keeping everybody's attention. We may have expired that, and we will, Senator Kirkpatrick had to go to another meeting, and I just want to, for your good and welfare, if you'll notice in your folder, the committee dinner, and time and place and all, much appreciated. And meeting's adjourned. Thank you.